Welcome, everybody, to another edition of Leadership Rounds. Today, I am super excited to welcome our guest, Dr. Shelley Nuss. I'll give you a brief bio, but then I'm going to let her do most of the heavy lifting. Dr. Nuss is the founding dean of the new University of Georgia School of Medicine and continues to serve as the campus dean of the Augusta University of Georgia Medical Partnership. Her extensive experience spanning nearly 30 years in academic medicine includes practicing internal medicine and psychiatry, as well as holding various leadership roles in undergraduate and graduate medical education. Dr. Nuss has been instrumental in expanding graduate medical education across Georgia and still serves as an advisor to the Georgia Board of Healthcare Workforce, among many other committees and projects. And I call upon her from time to time as I need to learn as well. So she is also a clinical professor at the University of Georgia School of Medicine and has received numerous accolades across and during the course of her career. Dr. Nuss, thank you for joining us today. Really excited. There's nothing going on at UGA for us to talk about today, I'm sure.
Absolutely nothing, exactly. And I just want to say congrats on that cover on the Georgia Trend. That was an amazing article too.
Thank you very much. Thank you. Appreciate it. But today is about you. So we're going to jump right in. We're going to talk a lot about GME and I think the new medical school, but let's start really more with you. If you'll tell us really what got you into medicine, how your career progressed from a practicing physician now into really the academic side and really being charged with and inspired to educate this next generation of our healthcare workforce.
Great. Well, thank you for that question. Thank you, everybody. Hope you enjoyed today. So, a little bit about me. I think, a fun fact, I have an identical twin, which is kind of interesting. And we're both doctors. And so my passion was always about helping and healing others. And so both of us found our way into medicine through pharmacy. And then, unfortunately, she went to the Ohio State University, not I can rub that into me all the time. But I have always, Caylee, been drawn to leadership opportunities from the time of my pharmacy background, which is my way into medicine. I worked 2 jobs and had to put myself through because the debt is great. And so went to med school, but my route was that. And just loved about taking care of people, loved the service aspect of medicine. But the leadership things were started, like I said, back at Purdue. I was chief resident and I was just drawn to them, and I cannot not do something in leadership, I guess. And so I don't know what it is, but I'm drawn to it. And so I think the other message about leadership is I really worked to have 5, 10, 15, 20-year goals for myself. And so, in med school was a course director after 7 years, and I became a residency director. My ultimate goal was to be in a medical school, like as an associate dean or a dean. And so you kind of built your way through your career, is what I did. I also was vice president of medical affairs at WVU Hospital as a hospital administrator for 3 years and helped launch Epic at WVU, which is one of the first ones out there that did it and were farthest along at the time. But then this amazing opportunity came where I could be in a medical school, and that was where I joined the medical partnership down here in Athens in Georgia. So it's been 15 years. It's hard to believe 15 years here as the associate dean for residency programs. And then when our initial founding dean, Barb Schuster, stepped aside, they asked me to apply to be the campus dean of the current partnership, which I've been doing now since March of 16, and then named founding dean in March of 24. So, but it's been a kind of, for me, I love leadership. I love being in leadership roles, but it also, for me, for those listening that want a path, I just make sure I had goals and what can I do to professionally develop myself so that I can move farther into leadership. You got to work hard. You're going to burn a lot of hours, and you're going to be working and doing everything that you can all the time to hone your own personal skills so that you can be successful as a leader as you kind of move forward in your career.
What does that look like for you today? I mean, how do you continue learning and continue your professional development path? Like, who are your peers and how do you keep growing and evolving?
The medical education world's fairly small. There's only 158 med schools. Hopefully we're going to be 159, matching with the number of counties here in Georgia in the spring, which is kind of a unique thing. But I think, so like, learning it from mentors out there. looking around you. What are the things that are working in that person? What's not working? And then I think just being true to your own north. I think for me, it's being me and authentic and genuine. And I have to be me, and you're going to be a leader a different way. Obviously, books can be helpful, but I also think just like learning the art of doctoring, as you go through your career, what worked well in these interactions, and then how do you hone those skills and do that? I think self-reflection is extremely important. We've all been in meetings where something didn't go well, and you're like, wow, was it something I did wrong? Was it something that they were responding to? So I think self-reflection on drives home is a good way to just, keep yourself grounded about what is going on. But I think leaning on others, we have a wonderful group of deans here at UGA. So now there's 20 schools and colleges here. We have separate meetings, but you always have those few that when you're in a crisis or need advice, you got to be willing to call them and ask, you've dealt with this. How do you deal with that? So I think having good mentors and peers is extremely important, but knowing what your limits are and where do I need to talk to someone? I will say I consider a seasoned leader, and I heard this from the past provost, Libby Morris. She said, Shelley, a seasoned leader is one that has dealt with or faced enough novel conditions and novel situations that they know how to deal with them. And so you learn those over time. And that's what I guess I call time on task. But you don't know everything. And a new thing comes up every day, and you got to reach out for help.
In that same vein, when you're building out your team and the team that works for you and with you, do you have certain skills or strengths that like I've got this part, but I know that I need to hire to fill these other maybe places where you're not as strong?
So I'm what I guess I would call an enabling leader, where I'm there for guidance. This is not an autocratic way. I'm there to support and build people up. That one book, Multipliers, is very interesting, which is create smart, amazing people around you. I can't be it all, but set them up for success in whatever way that you can, creating a supportive culture. But to your point, you need people around you that are strong and agile and nimble and can do the work, because as a dean, I've got other jobs. I've got to be on the road fundraising and doing a lot of other things, not afraid to delegate. And then, of course, I still think the right attitude and culture for what you're trying to build is extremely important to getting the right people to work with you, because it's the team effort itself that's bigger and better than just any individual member themselves, I guess, is kind of my philosophy.
I agree. Get on the bus. The bus is moving.
Yes, exactly. Right. And remove obstacles, provide resources so that those around you can be successful, and that's kind of the concept versus being a top down. I'm more about shared governance, coming to a consensus, getting a lot of input from a lot of people. But then, of course, there's a leader for a reason, and your wisdom and years of time on task, then you come to a conclusion and then be decisive when you finally decide something. That is one thing I will be once I've collected enough. I've weighed it in my mind, and it might not be one day, it might be a week, and then a decision's made, then you move forward. I mean, you can't second guess and look in the rearview mirror all the time, but get enough input from your advisors.
Okay, so let's talk really about your specialty, which is graduate medical education. Certainly been a topic across the state for a number of years, but I think increasingly so the last couple of years. I think there's been real concerted interest and even investment in moving forward our healthcare workforce really through graduate medical education. So, we often have to stop and educate our partners across the state on where education ends and residency begins, but maybe just high level for those folks on the call that don't work day to day in a residency program, really what graduate medical education is really all about. And then we'll have some fun questions.
Yes, well, good. So first of all, med school for the most part is 3 or 4 years. It depends. Some have accelerated programs, but you usually have to have an undergraduate degree, and you apply to med school for 3 or 4. But residency is that part that really takes you towards an actual specialty, like myself, psychiatry, internal medicine, general surgery, OB-GYN, pediatrics. So it's at least 11 years after high school till you get to be out to practice independently in the specialty. So that's where we're at on there. So it is a long road. So you have to have medical school, but you have to have residency programs. And I think the one thing that our member institution, frankly forgot, in my opinion, is they said, well, we're going to have a doctor shortage. At first, they said, Caylee, there was no doctor shortage. Then they reversed it and said, no, there is a doctor shortage, and it's a big shortage, and the train is out of the station, and it's going in the wrong direction. So they told every medical school increase enrollment by 30%. And they've done that. Every medical school in the country, including the campus I'm at now, grew out of that recommendation. But they, lo and behold, forgot the residency part. So here we've expanded all the medical student enrollment, but now we're bottlenecked trying to get in to very few residency positions, which you need to be able to practice and get a license. And so the push then has shifted. They said, well, we kind of botched it. We've got to go focus on residency program development. And so there's been a huge push across most states, I would say, that have shortages, certainly not the Northeast. They're the ones that have the most residents up there. But Florida, everywhere in the South, some Western, they said, we are going in the wrong direction. So not only are we going to increase med school, but we've got to increase the residency programs. And we've done that in Georgia. But Georgia was lagging. We're ranked 40th, 41. Some years it's 39 in the number of residents per capita. And so the states invested a lot of money through that great program that you mentioned to try and take what we had around 2,000 residents to bring it up to where we are today. And that's somewhere in the 3,000s, but we're still low as you look at Florida and some of these southern states. So we haven't quite caught up. But remember, Georgia does one thing really, really well. And that is if you do a medical school in Georgia and a residency program in Georgia, 72% of the time they stay here and practice. And that's why we're trying to really build the residency arm out, because we know that is what keeps the students here. It was the same for my sister at Ohio. She went to Ohio State. She stayed there for 30 years. I was in West Virginia. I practiced 23 years after my residency. So we're really trying to target across the state and grow the GME programs. And the state's been very generous in doing that. And so I don't know, is there more on that you wanted me to focus on?
Talk a little bit about what it takes to, the residency program really resides within a hospital with an academic partner. Talk about really what that takes.
So I did write a paper on this in academic medicine, which is the leading one. And I'm going to write a follow-up about what we've done here in Georgia. But I think to your point, for those from hospital systems in the state, it is a big lift and a mission and culture changing moment to become not just a patient care delivery operation, but to actually say we're going to educate future physicians through medical school, through students, and then through residents. It is a big lift. It's a financial lift, and you have to have the sustainable funds after you get it going, but you need startup funds, and that's what we did in the grade committee. But I think the other issue is you've got to have local champions and physicians on foot in the hospital that believe that that's where the hospital needs to be. You got to have the C-suite supporting it from the underneath. But at the end of the day, Caylee, the faculty are what make the quality of the program. And so if you don't have local champions that are driving it, and you don't need everybody in the building to believe in it, but you need a critical mass of internists if you're going to have an internal medicine. If you're going to do general surgery, you've got to have enough surgeons there to do it. And then getting some seasoned leadership, as I mentioned earlier, in your program directors, and then supporting the faculty in their ability to educate that future physician. So it's a lot. There's been a few health systems that could not put it up or sustain it. And that's because for all the factors that I just said, it does take a full layer of support in every aspect, even from nurses who interact with the residents to understand what it means to take a doc. I mean, we had here in Athens where a nurse said, well, I can't take an order off from a resident. And I'm like, what are you talking about? But there was an educational thing. Mm-hmm. They have a permit. They're a physician. They can take the order off from a resident, but it's that steep learning curve when you land students and residents that I will say cannot be underestimated. It is a lot of education across the top down. Even the board of directors at hospitals need to understand what they're getting into.
Yeah, and maybe there's some places where the model can work and are well suited, and some others that maybe aren't quite ready for that yet. So you've had a couple big projects on your plate the last couple of years in flight. So I think the entire state, it's no secret, UGA is ushering in a new school of medicine. Talk to us about that and where we are in the process and what your real vision for that is and what we can expect to see.
Right. Well, I just will say if it hits in February, like we're hoping, as I said, we were officially notified last Friday that we will be reviewed after our site visit in September by the accrediting body. And so we will hear on or around mid-February. And we'll be blasting out a lot if it goes well, which I have every confidence it will, but on our medicine.uga.edu website. So I will just say, honestly, it's hard to believe when I moved to Georgia that UGA, being the flagship land grant, sea grant university, did not have a medical school. Some people still to this day say, oh, well, UGA has a medical school. Well, it's been a partnership campus. It's been MCG's regional campus. And so I think for UGA, it's historic, it's transformative for the University of Georgia itself. But I will say it's transformative for the state of Georgia to have a land grant, sea grant flagship university of the caliber of UGA to actually have a medical school and really leaning into that mission and how can we help address some of these Georgia healthcare outcomes, access issues to healthcare, and how do we leverage all of that. Our mission is obviously to create excellent physicians. We've got to build out our research mission. And so we're working very diligently with our GRA eminent scholar, Yana Zabros, who we brought from Arizona. We're going to have a multidisciplinary translational medicine institute here. And that's really to leverage all of that amazing research that we're already doing here at the University of Georgia. Only 13 universities have full-scale agriculture, human medicine, and vet medicine, and that's called Precision One Health. So we're really leaning into that. And remember, UGA has the highest amount of NIH funding without a medical school. And so we're really looking at bringing that bench research to the bedside, to the patient. And of course, if you asked my GRA eminent scholar, I said, what is your goal, Yana? She said, I'm going to cure pancreatic cancer. And honestly, if you met this woman, you would believe it. In 20 years, we could be there. But she's got some amazing research that she's brought to us and $15 million of NIH research to really build on that. We're working really closely with a lot of healthcare partners, Caylee. So much excitement about partnering with UGA. 11 different healthcare systems have come forward to affiliate that we signed up on documents to go in with our application. Lots of physicians just excited to join and have a faculty appointment with the UGA School of Medicine. They want to train these medical students, and we're just super excited for everybody. So we just got a lot focused on the clinical arm, the research arm, and then really continuing to educate doctors that want to stay in Georgia and practice. I think that would be amazing.
I think it's a fantastic advancement for Georgia. And, we have Emory, we have Augusta, and it's never in our minds that we either or, it is all, and it takes us all. There's such a shortage and such an opportunity. I think there's more than enough opportunity for everybody. Will you talk a little bit about the capacity of the program starting in year one and how that will scale up and what you see, really the outcomes of that program being in terms of graduates in the next few years?
Yeah, good question. So I think one really common question I get is what happens to the Augusta University or MCG students here. So the 304 that MCG has per class, that is staying 304. So the 60 we currently have here per class are relocating between Savannah and Augusta. So that's important because when we add our 60, we're getting a net increase immediately. So we're not swapping out 60 for another 60. Do you see what I mean? So those 60 we're getting are going to stay here in Georgia and continue. But then our plan is with the new medical school building, and just want to thank the General Assembly and the governor for that initial 50 million, and then we raised the balance of the 50. That thing is already being bricked over there. It's hard to believe it's due to be open less than a year from now, but that'll allow the capacity to go up to 120 students per class. So we will double what we have now. We're going to be at 480, but that's several years down the road. And of course, it's always dependent about us going back to the accrediting body, making sure that we're fine. But we can go to 72 per class here without that new building. But beyond that, we've got to go up to 120. So we're really going to hopefully make an impact. I will say, when I left the state of West Virginia, we had more medical students per capita. I came to the state that had the lowest number of medical students per capita, especially if you looked at public medical schools. So very important for students from all over the state to have two public medical school options. more affordable than private. And some people just frankly like being in public medical education. But this is a real opportunity, I think, for really everyone who wants to stay in Georgia. It's really going to increase the capacity tremendously and opportunities for lots of students.
So potentially new, 100 plus new graduates coming out in the years to come that hopefully will come work at our institutions, at our medical institutions, and stay here and help continue to provide care for Georgians. We're also talking about a more recent development this year is that there's now also a nursing school at UGA under development, correct?
Yes, that was another exciting thing that happened back in May of 25. The Board of Regents said the University of Georgia, you can go ahead and also create an accredited school of nursing. And so I think it's public knowledge at this point. There was a press release, but Dr. Carolyn Clevenger, who also is a Georgia Board for Healthcare Workforce board member, governor appointed, is going to be the founding dean of the School of Nursing here at the University of Georgia. So I've been a colleague of Dr. Clevenger's for many years. In fact, she was at WVU, also my alma mater. I did not know her when she was there.
Oh, wow.
But she's super excited. She starts actually January 1 of 26. So she's been popping over here a little bit. And I think hopefully down the road, they'll also have a newer facility out here on the health sciences campus. So very excited. We've got public health here right out my door. Then we'll have School of Medicine and then eventually the School of Nursing. So it's on track for fall of 27 to accept its first students if that all moves ahead with its accreditation. And again, for School of Medicine, we're fall of 26.
That's really exciting.
Really fast timelines.
It is fast. You're definitely busy. Before we came on into the full group, we were talking about just what you're seeing among medical students today and how their desires for and what their expectations in the workforce are and how those have changed. We talked a little bit about that. I mean, I think so many of our hospitals struggle with recruitment, especially in rural areas, and how they staff physicians and service lines. And I'm curious for you to share with them kind of your observations and what you're hearing.
So I've only been in academic medicine, never in private practice. And so that's been spanning close to 30 years. And I think, medicine is a very busy job and it's a service organization. I mean, you are there for the patient and you will miss soccer and you will miss football games. You'll miss the national championship. Things happen, right? But our students of today, I think, are definitely more focused on work-life balance. And how do you do that in a family where maybe two people are working so that, the cost of goods and services have gone up? They are more mobile. There was no technology when I was in medical school. And so I think they're looking for different things. I think the other thing is they generally have $205,000 of debt is the average amount. The loan repayment is a concern for students when they're looking for positions. But the work-life balance, I don't think is helping us in terms of folks wanting to go into primary care, which is an issue. I think they are choosing things like shift work, like emergency medicine, hospitalists, laborists, surgicalists, things that tend to be, more shift work and then having more time off. I don't think it's always about having the highest salary. I mean, I think a lot of our students will tell you if I can make $250 and work a hospitalist job and work 26 weeks a year, yes, the week they're working, it's 80 hours, but that's normal for us to do. And so I don't know. It's just a shifting landscape as we think about how do we recruit, retain, because you want to recruit and retain them for the long haul. So building the GME, back to your point, Caylee, the GME is valuable because you are creating your own pipeline and you get to then hone those and pick the ones you want, and then you keep them in your organization. So making a good influence when they're on rotations and stuff so that they see what it's like to work there also helps to create a pipeline that keeps going. But the GME does create a pipeline for the hospital for sure and saves on recruitment costs for the hospitals.
Well, if we can ever be helpful, send in us or our members to come help with your new, first year student orientation. We're happy to do it. Tell them that we're waiting for them and what it takes. Only 1 or 2 minutes left. I've got 1 or 2 more questions for you, but anything else on the GME topic that you just want to add that I haven't asked you already?
No, I think if the listeners want, there's an article that was back in Academic Medicine a few years ago. If you just looked it up, it was called Statewide Expansion of GME. That has a lot of nuts and bolts, how we did it, what we did, lessons learned. And then I think it was very successful, but we've got to do more. And so I think the state investment, continued investment to sustain the programs is helpful.
All right. So you said you're always setting a goal, 5, 10, 15 years. What's the next big goal? What's 5 years from now for Dr. Nuss?
Well, first of all, I want it to be less about me, I guess. But first of all, we've got to get fully accredited. So right now we're only through Hoop 1 if we get accredited in February. Then we've got to go to provisional accreditation. Then we got to go to full accreditation. So it's going to be another 4 to 5 years till we're fully accredited at the UJ School of Medicine. I think the other thing is that have we made an impact on some of these Georgia health outcomes? Are we trying to address access to care? Have we produced doctors that want to be in Georgia? How do we attract the best and brightest here at the University of Georgia and to all of our medical schools? So I don't want to focus so much on me. I want to keep supporting the effort here at UGA and then really try and make an impact on what we're doing and through the research and the other things is what I would say.
All right, maybe 2 more questions and I'll let you go. What books are you reading right now?
I think a travel book about where I'm going to go in Italy next summer.
Oh, where are you going?
I don't know yet. I need to come up for air. I think, one thing I think for those of you just in leadership, I'm not very good at saying no, you know what I mean? That's probably to my fault. And so I work really hard. I think we all do in leadership, but sometimes we do need to take care of ourselves a little bit better. And I've gotten off the Peloton where I was on it more. And so I like that book, Multipliers. I think that might a recent one, but I think just leisure reading and things like that. And, but you got to take care of you and balance. And I think that's the other challenge, Caylee. I think people see the burnout from COVID. It's nurses, it's pharmacists, it's doctors. So I think there is more of a focus in medical school education and residency, which is how do we make sure the workforce we're training and educating are going to stay in it for the long haul, and how do you support them through it? And so, I guess that's what I would say. If I had to say tips in what's my leadership style, one, absolutely lead by example. You've got to, if you're going to leave at 2:00 every day, what does everyone else think? It's okay to leave at 2:00, but I think leading by example, I think transparency, communication is huge, and then integrity at the end of the day. You know what I mean? One of those non-negotiables for me is good night's sleep, if at all possible, and be prepared. There's one thing you can do, it's be prepared for your day, and you got to do that. And there was one other thing I wanted to mention. The most important thing that I've learned over the last 18 months in my current role is how do you absorb the pressures so that your team is not feeling the pressures, which is a very interesting concept. But, there's a lot of pressure on all of us that are in top leadership jobs. And how do you handle that pressure so that I feel like as a leader, I should be trying to absorb that so that it's not pressuring the team so much, so that's part of my other job, I guess, is being the dean. It's the other things that not the day-to-day operational part that I think you just learn by doing as well. You know what I mean? And taking on progressive responsibility. So I don't know.
Yeah, Kara Lawson, the women's basketball coach, talks about how they teach people to handle hard better. Mm-hmm. So doing it for your team. Yeah. All right. Well, let's leave it there. I am going to follow up with you offline about Italy, but thank you so much, Dr. Nuss. I know our audience today appreciated it as well. We are fortunate to have you at the helm and doing what you do to improve healthcare across Georgia, and we're excited to continue being your partner. I'm sure I will call up on you again.
Okay. Thank you, and have a great day, guys. All right.
Thanks,
take care and go dogs, baby. We're going to do it. Take care.
Thank you. Thanks, Lindsay.